Okay, so we're back with another episode of Earnest Medicine. Today we have Dr. Danielle Clare, physical therapist here in the Washington, D.C. area, and somebody who Dr. Brown has had an opportunity to work with, I think maybe on one or more occasions. I'm not sure at this point.
It was really just by circumstance. It was really coming in spur of the moment. We have a mutual colleague, Frank, who has helped me in the past with my VIPs, and he was like, I've got somebody for you. And lo and behold, that was Claire.
Excellent. Well, we'll roll our intro and then we'll kind of get into it here. We'll go through a little bit of an origin story and find out some of the motivations for why Dr. Clare, Danielle, however you want to do the introduction, sort of the motivations behind why she got into doing what she does and how she's helping people both in DC and beyond. So let's get it started. All right, so we're back. I'll turn it over to Danielle and let her kind of run her introduction here and sort of introduce everyone to yourself. So go for it.
Hi, I'm Danielle Clare, physical therapist and owner of Clear Motion Physical Therapy. My background, originally I'm from the tri-state area. I grew up in Maryland, like 15, 20 minutes outside of DC. Okay. Moved away for college and PT school, and then made my way back here well over a decade ago. And ever since I knew I wanted to go into the world of physical therapy, I had an itch to open my own clinic, and basically had a handful of years of experience, and then finally developed the courage to do so.
Bravo.
Yeah, thank you. But essentially what led me to the path of physical therapy is I've always been intrigued by science and the healthcare world. And when I went to college, which feels like forever ago now, I was kind of in 50-50 on whether I wanted to go into physical therapy or pre-med, actually. Mm-hmm. So the course curriculum and prerequisites are pretty much the same path for either one. So I was on the route, and then had various internships in both physical therapy and shadowing orthopedic surgeons. And I really loved the connection that the physical therapist developed with their patients. And I'm a people person. I'm very extroverted and love to just be around people, and develop that connection with people. And so that I found very special. And that was what made me kind of continue down the career path and kind of seeking more of the physical therapy aspect of things. And then I went to PT school at Northwestern in Chicago. Nice. And was there for 3 years, and then made my way back here. And when I first graduated from PT school, wonderful experience, but was in a very busy in-network clinic where I was probably treating 2 to 4 patients in an hour. And I found that the quality of care just wasn't what I wanted it to be. Now, it was an awesome place to get started, fresh out of PT school, and jumped in with 2 feet, got my feet wet, learned a ton, saw many different cases and different things to kind of be exposed to just the many different injuries that patients may have. Great mentorship program with that. And then after about 3 years there, I went to an out-of-network clinic where it was complete one-on-one patient care, and patient sessions were about an hour long. And so as coming from a clinic where it was back to back to back, or you had multiple patients in the same clinic in the hour, I wanted to basically be able to provide more hands-on, one-on-one. So I found exactly what I was looking for. And I was at that clinic for about 6 years, a little over 6 years, and then finally said, okay, it's time to do this on my own. And I think from having those different experiences and really having the passion and desire to go off on my own and open my own clinic, I that is essentially the path that led me to where I am today. And I rent or I lease space from Vita, which is an amazing gym in DC.
Bravo.
And so it started off as I was close with a few of the trainers there. And where I find that patients typically benefit the best is if all hands on deck. So if essentially they have a personal trainer and a whatever, doctor and a physical therapist, whether it be functional medicine, nutritionist, primary care, ortho, regenerative medicine, any kind of doctor, I always like to have all hands on deck. So over the years, I've developed a lot of connections with personal trainers at different gyms and running coaches and coaches and all sorts of, triathletes, whether, in the sports world. And so when I was thinking about going off on my own, I thought it was important, and I thought it could be a very cool thing to be in a gym, to basically have access to the gym and to be able to have everything in one place, or a lot of things in one place. And so I reached out to one of the trainers that I knew well, and I said, hey, I'm thinking about doing this. Who do I talk to? And so after some time, I finally got put in touch with the right person to kind of make that happen. And we were able to set up my first office at their Gallery Place location, which has been great. And I've been there for a little over a year now.
Fantastic.
And then recently, the past, I'd say probably like 4 months ago, I went ahead and they had some extra space in their U Street location. So I went ahead and opened another clinic there. And it's been a very, very exciting journey. But I think the most important aspect of it is being able to shape my practice how I feel will be able to provide the best patient care. And I feel like I've very much so been able to do that. And it's been a really fun ride for that. So that is a little bit of my backstory.
That's great.
Very detailed. That's great.
What does a typical day look like for you?
So typically when I first started, I had the role of, I was doing the scheduling, office admin, accounting, treating patients, marketing. And so a typical day, I'll see anywhere between, 6 to 9 patients. Each of my sessions are 50 minutes, completely one-on-one. And then, I'll pack up for my day and go home and do some admin stuff. But I say recently I hired an office manager, and she's been amazing to help schedule patients and take phone calls. So that's been that's
vital.
Huge. It's wonderful. But and so each patient that comes in is unique in their own way. And I think what is one of the most fascinating and kind of cool parts of my job is every patient's a puzzle. So regardless of if one patient were to walk in with shoulder pain and another patient were to walk in with shoulder pain, and maybe it's the same diagnosis, they have, let's say, a tear in one of their rotator cuff muscles, the treatment will be different depending on the patient and their goals and what they can tolerate. And
very true.
I'd say I'm a very manual-based therapist, so typically what happens is a patient will come in for an initial evaluation. I'll do an examination on them, come up with a diagnosis. DC is direct access, which is great, so patients can come see me without having to have a referral from their primary care doctor. And if I feel like they need outside help, then I will absolutely, send them to wherever they may need to go. But if I feel like I'm able to get them better, and it's something within my scope, then we'll come up with a treatment plan. And a lot of times I feel like if I can give patients, if I can educate them on exercises to do on their own at home, and then make sure that I'm checking their form and progressing the exercises and keeping them challenging for them, I will watch them do a few of them in the clinic, but then I'll say, okay, do you feel comfortable with this? Your form looks good. Every muscles are firing correct. properly. I like to have my hands on my patients the whole time.
Yeah.
And then if I feel comfortable and making sure that they're doing them properly at home, then I'll say, okay, the rest of the time is going to be spent doing manual treatment. And in my sessions, again, depending on what is going on with the patient and what the patient may be able to tolerate, do a ton of different manual therapy techniques, such as joint mobilizations, joint manipulations, dry needling, which is a great way to release tight muscle and to reset the muscle, if you will. I have a laser in my clinic, which helps to get to the cellular level and helps to bring more blood flow, oxygen to the area to help with healing. I have a shock.
And we'll get an opportunity to be able to see you in action.
Yes, absolutely.
Which will be exciting. So everything that you're talking about now will actually get a chance to have the viewers actually see it for themselves and maybe know the difference, which is important. So.
Absolutely. And I utilize cupping and Graston techniques. So depending on the patient and what they're presenting in front of me with, I typically will do a combination of different manual treatment techniques, but have a lot of fun things and fun different tricks up my sleeve that I utilize to help get patients better.
Yeah. I had a quick question. I know a lot of the individuals who I know who've gone into this field have been sort of athletically motivated. They were very involved as kids. I grew up with some of these folks who were just like always traveling, whether that was basketball, football, cross country, track and field. I know you talked about the communication element being one of the big motivators to choose this route over sort of the pre-med, maybe in undergrad. But when it comes to even further back in the origin, were there motivators like athletic performances that you were involved in or things like that sort of were like, I would really like to transcend just this competitive spot and help other people get better themselves?
Yeah, that's a great question. And absolutely.
I miss it. Yeah.
Yeah. When I was younger, I was a competitive gymnast actually for many years.
Yeah.
And then that became a little burnt out, if you will. And then actually was a cheerleader in high school and tore my ACL cheerleading. So I was in physical therapy for about a year. I had my ACL was completely torn. So that's how I became interested in orthopedic surgery because my ortho and I had a great relationship and it seemed fascinating to be able to do surgery and be in the OR, and that got me really excited. And then developing that connection and relationship with my physical therapist and being there 3 times a week for a year, you get to know someone really well. And so I'd say that was the thing that I think sparked my interest in the outpatient orthopedic world, whether it had been pre-med, med school, or physical therapy.
I mean, you have a sense because you're a competitive athlete that you get a little bit more. And that's one of the things is you kind of practice what you preach in a sense, but also you've experienced having the injury yourself too. You know the impact it has, not just physically, but you know how it affects everything in your life.
Yes.
And how important it is if you can find the right therapist and the right orthopedics, it makes all the difference in the world.
Absolutely.
And it is about relationships. That's where it really is.
Yes.
So one of the key things is obviously you take health insurance, right?
So I do not take health insurance.
I like you. Now, why don't you take health insurance?
So let me explain a little bit. So as much as I would love to be able to take health insurance, to be able to provide that one-on-one patient care, unfortunately, in the world that we live in today with the health insurance world, I wouldn't be able to provide that one-on-one patient care. And then for the in-network clinics, then you're looking more to moving in-network and seeing multiple patients an hour. So I have found that I'm able to provide much better treatments and spend that one-on-one time with patients. So I am an out-of-network PT.
As am I.
Yes. However, as a courtesy, I do submit claims for patients on their behalf. So I don't participate with insurance companies, but I have found that a lot of patients really do appreciate getting the claims
Have you seen
submitted.
that getting harder and harder when you submit rejections?
So that's a great question. Being an out-of-network provider, I unfortunately cannot participate with Medicare at all.
Yes.
So that's not an insurance company that I have any connection with. The other insurance companies, it totally depends. So some of my patients get, I want to say, 80% reimbursed, depending on their plan, depending on their out-of-network deductible. But like a lot of my World Bank patients, for example, get that 80. They have great insurance plan, and they get that 80% reimbursed, and so they're basically paying me. I'm cash-based clinic, so they'll pay me up front, and then as soon as I submit the claim for them, they'll get a check from their insurance company reimbursing them, and they're like, it's basically like me just paying a copay.
Yes.
And then some of my patients, unfortunately, don't have as good of coverage, and they're completely out of pocket for that. But I think I will say a lot of my patients come see me after they've been to several other physical therapists or have had different experiences, and they haven't seen results, and they get my name or my information from someone, and they come and they're like, so you're my last resort. I have tried everything, and I'm kind of giving up on this. I don't know. Maybe I just, again, I work with a very athletic population, and I'd say the chronic pain population, and a lot of hypermobility as well. So I'd say it's very frustrating to try and then not see results. So I get a lot of, I'd say, kind of upfront discouraged people who are like, oh my gosh, this has been such a frustrating road, and I just want to get better, and I just want to get back to doing the things that I love to do, but I can't, and I keep flaring myself up. And I'd say being able to spend that quality time and that one-on-one and really dive into the nitty gritty. Again, as I go back to what I said in the beginning, each patient is a puzzle. So really finding what specific things they need in their treatment plan, in their exercises, through manual treatment with me. I'm a lot of the time able to get patients back to where they want to be. And I think without being able to spend that one-on-one time with them, I wouldn't necessarily be able to get them to where they want to be as quickly or get them the results that they would want.
I mean, that's the therapeutic relationship.
Yes.
I mean, the foundation for all of this is that the patient is on a journey, and unfortunately they come to you as a last resort.
Right.
So then in a sense you have to kind of clean up what was not done and reorient them. And for those who get it, it's a life changer,
Huge.
Yeah. I mean, even if it's possible to reach out to some of your clients that might be interested in telling some of those stories, because we know the level of frustration. And here's the thing. Insurance company loves when you go out of network, because then they don't have to send patients to you, and their bottom line is protected. Right. I've been seeing more, and we work with a company called Reimbursify. So we're not directly involved, but we tell patients, work with Reimbursify, and they'll help you. Yeah. And over the last 5 years, it's almost every claim is rejected the first time. And
really?
It's insane.
That is insane.
And it's all about them protecting their interests. So, and I think it's only going to get worse, because they have, their board of directors and things that they have to answer to every quarter. So
right.
I wanted to ask, I know this is a big topic that we have, right? You're not necessarily in network, you're not taking insurance. And when it comes to the world of physical therapy, do you find that makes you a really big outlier, or is that maybe a little more common? I know Earnest is rare in the sense that there aren't many house call docs, right? I mean, I don't know about where you're coming from with that. If you're very rare in that instance, or it's kind of picking up some momentum, more people are doing it?
I'd say more rare for sure, but I'd say more and more doctors and physical therapists are starting to go out of network and starting to kind of see the benefits of, okay, I can spend more time with patients and have that quality care.
Right. But also the quality of your own life.
Right.
So that's the trade-off. I mean, if you're burning through 2 patients in an hour, you are feeling it.
Right.
You may not, acknowledge it, but over time, it's not sustainable.
Right. Absolutely.
And then, we talk about the burnout and, those sorts of things. So, it's an unfortunate situation to be in.
Right.
Yeah. And I think that's especially true. I go back to Kim Parker, who we met with in Washington State, a massage therapist licensed up there. And it's like that kind of activity is extremely taxing on the person who's doing it. I think much the same as physical therapy. I mean, like you said, you're hands-on, you're right there with them. And if you're doing 2-3 an hour, like you need a little bit of a break at times, and consistently doing that is going, I think, to wear you down over time. So, yeah.
But also, when you take the time, you process things. You think about things. Like I'm sure when you see somebody, it's not like, okay, they've left the room and you don't think about them anymore.
Right.
I'm sure what's going on inside your head is you're probably, even as you're riding your bike home, you're probably thinking about that.
Yes.
And then it gives you an opportunity to kind of really develop yourself so that, clinically over time, you become a master.
Absolutely.
As opposed to a factory worker.
Yes.
It's not just assembly line. Like you said, everyone is different.
Right.
So that makes you a better clinician. I think in the current spectrum of, just factory work, we are generating bad clinicians.
It's unfortunate.
Yeah.
But yes, I agree.
And I've seen it consistently. And many times I get called in because I'm there to clean up a mess.
Yeah. And I'd say very much so.
Yeah.
Myself as well. Yeah.
Yeah.
And you have to think of all the economics of all that time, but also the pain and suffering of individuals too, which,
Right.
I'm sure when they come to you, it's kind of like relief. And so it's a very different experience.
Yes, but definitely frustration up front at first too sometimes, where patients are just like, oh my gosh, I've been through the ringer. I'm not getting better. I'm very frustrated. This has nothing to do with you, but it's just my journey and my road this far. I just want to get better. And I am picking up the pieces, and as you said it perfectly, kind of cleaning up the mess, if you will.
Yes.
Do you think there are some factors that differentiate your practice whenever somebody's at that final, like, I'm so frustrated, you're my last hope, whenever they're at your doorstep? What separates you from them going to someone else and getting that same quality of care or similar? I mean, what, in your own words, what do you think?
Yeah, that's a great question. I think communication has a lot to do with it, and really sitting down and caring and being there, not just during the session, but I'm very available to my patients outside of it, which is personal brand, probably not great with that. But it's hard for me to turn off. And I always tell my patients, I'm always here. I'm always going to respond. You can call me, you can text me.
I know that well. Yes.
And so I think building that relationship and that trust level, and then checking in with them, even if they're feeling fine, and then giving them a call or shooting them a text in between sessions, and just saying, hey, do you have any questions? Please know that I'm here if you need anything. And consistently with each session that they come in, hopefully the goal is for them to feel better, week by week. But really checking in and seeing how they're doing. And if they're not making progress, changing up what I'm doing and really honing in and making sure that I'm doing the right things to get them on the right track. And I'll say, another thing is I work very closely, as kind of we talked about before, but with a lot of other doctors. And I think that all hands on deck and making sure that everyone's on the same page is so important to the patient care. And that's really what is going to get the patient better the fastest. So for example, with personal trainers that I work with, I will call the personal trainer after I see the patient for the first time and say, hey, these are the things that I found in my exam. These are the things that I think you should either avoid or modify. And then these are the things that really make sure that you're honing in on and focusing on in your sessions. And if you have any questions on how to modify or what exercises to be doing, let's brainstorm, and then be in constant communication with that trainer throughout the duration of their treatment with me and after, if the trainer continues to have questions. And then with doctors that I work with, as I mentioned, I work very close with a lot of the regenerative world doctors. So making sure that
RSM,
and making sure that I have communication with them. And if I'm sending a patient to them saying, hey, you're seeing patient X today, here's a little bit of background on them, and stay in communication. And if someone's sending a patient to me, like with Frank and him sending our mutual patient that we saw, always just being in constant communication and saying, hey, this is what I found, this is what I think, what do you think, are we on the same page? And really making sure that everyone is on the same page with treatment.
And that's the dynamic, because for this client, that we were involved with. It first started off from the client with the relationship that I've had with the client's parents over an extended period of time is deeply rooted in that relationship. So there's a sense of trust.
Yes.
And so once they presented this problem, then it was a matter of figuring out who are the other colleagues to, bring into the fold, because I like to be a team member. Partly in some regards, because the more team effort there is, the better the outcome.
Absolutely.
And then also the other sense of, I like not to be alone, because to share not the misery, but to share kind of the experience, which is what we're doing now. Because that's the richness of life, right? And you always have the opportunity to learn something. So even when this was presented for this client, and immediately texted Frank responded back in 30 minutes. He was like, yeah, we'll open up the clinic on a weekend and get him in. And I met them there, was with the client and Frank, collaborating on it, providing the information that was necessary. And then lo and behold, oh yeah, Claire, yeah, she's the right one. That's exactly how he said it. And that only provided another sense of relief on my end, that there really is, there are multiple people involved on this, that the outcome will be positive. And I can say now that the client, who has just returned to DC for a short period of time before traveling, is much better and is actually participating in regular activities, where before even just ambulating or walking around was difficult for them. So. And I wanted to share that with you. I wanted to give you the update, because it's also vital to know that what you've worked on, the outcome and the impact you had, not just, this was a client and this is how we build them, and this is, it is the richness of it. It comes back in dividends more than really the financial part of it.
Oh, absolutely. Absolutely. And I think, that's a big thing of making practitioners and doctors different, is the collaborative, all hands on deck. And I think very, very clearly the results are amazing. And it just, my job is to get people better, and it makes me happy. And
exactly. That's the thing. You can
It's a passion, and it's very fulfilling. I've checked in with her mother at times just to say, hey, how's she doing? And I've gotten positive feedback. And so I'm so happy to hear that. So
and this is,
wonderful.
A young client that, if there was an intervention, longer term, she probably wouldn't have been able to participate in sports.
Right.
And she enjoys doing that. So a loss of quality of life, right? But also, maybe more significant injuries over time too.
Yes.
So it really was talking about, more than just, oh, here's the problem, fix it and goodbye, good luck. It's more of, well, let's work together and let's take this journey to figure out what's going to be the best for you.
Yes. And I think a big thing too with that, once her pain level was decreased with me teaching her and her mother, hey, these are things that you can be doing at home, and these are things that you can be doing to progress, to make sure that you stay injury free and that this doesn't reoccur or flare up in the future. So I think that patient education is always really important. Yes.
Once they've seen the value of it, then you can impart some education in it that then really seals it. And then the thing is, it's almost infectious. Once you start to give them this knowledge, then they're educated about it. It's not, I like it when patients are provided the opportunity to feel empowered and engaged.
Yes.
And that's the opposite of what we have in healthcare now. They're not empowered and they're not engaged. They're just, pieces on the assembly line. So, that's one of the reasons why we are, capturing these stories, talking about your journey, your background, and kind of how we met and those things, so that it can start to open up people's minds about possibilities.
Right.
And over time, as we bank all of these materials, then, a following, because we're not, it's hard to change things when we didn't create this, right? You have been creative enough to go out and stake a claim for yourself. And as I have, I'm older, so, it's like I've been doing this. I'm salty dog now. But, what are your thoughts in terms of how you bring others to share the same kind of passion, but also, because that is the other part for myself. I am getting older, and I have to think about legacy. I have to think about what am I then passing on. Right. For instance, even for what I've done as a house call physician, we have started Earnest Medicine, and we've started our nonprofit Humans for Healthcare for the sole purpose of, I'm not going to be here forever, and then I got to pass it on. And I'm not trying to be morbid about it, but you know, it's a certain sense of, okay, everything you're doing is great. How do you spread that?
Yeah. So I think that's a really good question, and that's a really good point. That's a hard question.
I'm not expecting an answer now, but it's something to kind of, because I challenge even like Jim, you know, and others every time. I'm always like, what's your legacy?
Right.
You know, what are you passing on?
Yeah.
You know, and it seems kind of annoying to do that to people, but there's a purpose for it.
Yeah.
You know, because I could be hit by a bus tomorrow.
Right.
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 Oh yeah, Dr. Brown. Yeah. He didn't walk fast enough.
Your legacy.
Hopefully not.
That's my legacy.
But
okay,
you
great.
I mean, you never know. Like life is very short, and that's a very good question and a very good point. And I think I don't think I have thought about it in that aspect yet, to be completely honest. But I with thinking about my practice and thinking about just patient care in general, I think being able to educate patients on the quality that they're getting when they see practitioners like us, as well as I recently hired my first employee at the end of January.
Congrats.
Thank you.
It's a big step.
And so I spend an hour a week mentoring her. And so we have time blocked off in our schedule where we're not treating patients every Tuesday. And we go through, we discuss patient cases, we discuss whatever she might have questions on, and then we go over manual skills and how she can kind of continue to hone in on her skills. And I think
so you are passing it
on. So with that question, I'm thinking about what I'm starting to do, and yes, and helping her develop her skills as she's already an amazing physical therapist, but continuing to practice and hone in and learn more and about. Yeah. She came from an in-network, very. Yeah. How many patients can you get in 1 hour clinic, and so. For her to be able to see what impact she can really have with spending that one-on-one time with patients, and how much better she is able to get patients so much faster, has been a 180 and an amazing experience for her so far. And then every week she's just like, this is wonderful. And she's like, I'm really happy. My quality of life is, you know, it's not that stress level of, oh my gosh, we're just focused on productivity and how much we can bring in and how many patients we can bring in. She's like, I see you really care about your patients, and you really, you know, you're making a huge effort to really just get patients better. And she's like, that's amazing. And I think the mentorship that I provide, and, you know, she teaches me things too. It's it kind of goes both ways. And so that I'd say starting with that, and then continuing that as kind of I grow my practice. I never anticipate myself getting really big. I like the intimacy of having a smaller clinic, but bringing on, you know, a few more PTs over the years, and really continuing to have that one-on-one mentorship with them as a road to keep them learning, and with continuing education classes and discussing what, you know, hey, like, what do we think is going to help hone in on your skills that you want to get better at, that you want to learn. So I think that is the beginning of the answer to that question.
So. I would say for myself, it's challenging because, you know, I'm adjunct at, you know, different universities, and I will take medical students and residents out on house calls. But just where things are now in healthcare, I'm so far out of their realm of their training and their education that it freaks them out, and that they don't see how it's even possible.
Yes.
And so it's been discouraging. I'll be honest, it's been very discouraging for me to find other physicians to be able to mentor, in part because what I do is so very different.
Yeah. I mean, I think it goes beyond just the practice. I think it goes into a lifestyle. You have to live what you do, and you have to like what you do.
So you have to love what you do.
Right.
Yeah.
And so it's more than just being good at it. I think you have to really be passionately in love with what you do in order to... And that's hard to, it's hard to find that person. And it's hard to hand over the reins to somebody because, I mean, will they love it like you love it?
Right.
Well, I mean, yeah. And so we'll see. The story isn't finished yet.
Yeah.
But,
True.
it's certainly being written. But I'm hoping, that when we actually were involved with this client, and this is where this is what I do. You are in a clinic. Mm-hmm. And I brought you out of the clinic.
Yes.
In a very sneaky way. And begged you to, on my hands and knees, and to actually come out of the clinic and actually visit this client in their home. And what were your thoughts when I, you're like, what? I mean, because the initial impression was that you really wanted to drive it to the clinic, but you didn't see what the client was, and you had a much better maybe reference when you actually were in their home.
Yeah. So I think I mean, after talking with Frank, and then after you and I connected, I think I got a text from Frank being like, hey, can you talk? And I gave him a call as soon as I got his text, and he filled me in on the story. And then he connected us via text, and we talked a few minutes on the phone right after that. And you kind of educated me on the history of everything. And I think at first I was like, oh, this is definitely different and new. But then after talking with you for a little bit about that, as cheesy as it sounds, I like helping people, and I like getting people better. And so I was like, okay, when does it work for them? This is my schedule this week, but I think we talked on a Saturday night, and I think Sunday morning we were
yes, we were there.
we met.
Lo and behold,
and so, I think if I'm able to carve out time in my schedule, like we were able to, and figure something out, I'm always happy to go outside the box and do that, because it's fun, and it's building relationships and learning new things and meeting new people, and again, ultimately coming down to making people feel better.
Exactly. Yeah. And DC is an international city, so we have opportunities to different cultures, different belief systems, different health, and it's just fascinating to kind of, and it's a lot. It's intense. That's why it's not for everybody.
Yeah.
Right. I mean, when you're in, you're in.
Yeah.
And, and that's what I always say, that I'm always all in.
Yeah.
And when we were able to do it and to share that experience, it also was a certain sense of my appreciation for you, because there are plenty of other, clinicians out there who are like, no, and don't do that. This is how I do it. And that rigidness, to me, I just don't get it.
Yeah.
And, you're missing out on a lot when you don't at least explore the opportunities. But I would say that I would encourage you to maybe come out on a few. It is very sporadic, I would say. I am always on call. So in that sense, Frank knows that, if I get something that comes in, it comes in.
Right.
And we did actually have 2 other clients that Frank recently just saw, and I've been thinking about you. But I wanted to find the right time to be able to bring that into the discussion.
You can always text or call me. I'm always happy to try and kind of make something work. If I can make it work with my schedule, I'm always happy to try and figure something out.
But it's also with them, when is the time right for them?
Sure.
Because they have to have an appreciation and understanding, and they have to be all in too.
Right.
If they're not, and they're just kind of like, then I don't want to waste your time.
Right.
Or theirs or mine. But I think we're a little bit closer, so I might be reaching out to you soon.
Yeah, reach out to me. That's okay. You have 100%
they're not far away. Yeah,
full
okay,
permission.
great.
I don't mind at all. It's fun. I will say though, definitely, I didn't know what to expect when I was walking into that situation. I was like, okay, I'm going to this person's house. Am I doing an exam? Am
Yes,
I
I
just
know.
meeting
I
them?
know. I didn't.
And then dove into an exam introduction, talking a little bit, and then got the nod from you being like, okay, why don't
Yes.
do an assessment, do an examination, and I'm like, let's do it. Okay.
I mean, our minds, our clinical abilities are not, constrained in a clinic, and
Right.
so I mean, it's just a matter of just turning it just a little bit, and then you have everything.
Yep.
You don't have maybe some equipment and those sorts of things, but that's different.
Right.
You have this
Exactly.
and if you have the ability to adapt to those situations, it does keep you on your toes.
Yeah. Which
And
is fun.
Which is
That's-
a lot of fun.
Yes.
Which is what I really like about it. There's
Yeah.
never a day that's exactly the same as the
same.
next.
No, it's never boring. It's always,
Yeah.
you're always thinking, you're always, again, putting together the pieces of the puzzle.
Yes, exactly right.
I had a blast doing that. And
Yeah.
I was like,
It was
okay,
fun.
let's dive right in. Let's do it.
Yeah.
So yeah, keeps me on my toes, which is a good thing. But
I wanted to cut in here and just ask one question. I know Dr. Brown works closely with certified personal trainer Carlos Fenwick. I don't know if maybe you've met Carlos. Is he an Equinox guy? Is Equinox and Vita
He
like?
was at Vita
No?
for years.
Are they?
was he?
Are they
I-
headbutting?
I don't think so.
No, they're not like rivals or anything.
No.
Right? Okay.
Yeah.
Okay. Well, I know that Carlos is really good about utilizing certain pieces of software and apps in order to track the progress of the people that he works with. And that's one of the things you talked about. It's like communication is so important, having the interconnectedness between yourself and other practitioners. Are you utilizing any pieces of digital technology that help you make sure that you're following up? Or maybe this is proprietary and you can't say, but I'm just curious.
I would say, so my medical software, every time a patient comes in, I'll document. So I have it in documentation, where are you? How are you feeling? Any setbacks? What are you feeling better with? And then, I don't have any sort of essentially technology.
A magic wand.
But I guess I'd say I probably am.
You don't have AI? I mean, come on.
I wish I did. But
It's
I
coming.
think I don't know, maybe anal's the right word, of keeping up and making sure that
Yeah.
I'm keeping track of all my patients. So within my medical software, I go through and I kind of look at the patient list in my medical software.
But you
and
don't
I
have
say,
thousands of patients, so that's the thing. You
Right.
have that. You have the capability of doing that because it's refined.
Right.
There are different applications. Like Carlos tracks me, which I'm not too sure if I approve of. Somehow that happens.
He's geolocating you.
Trainerize is so it tracks the workouts that we do and weight and those sorts of things, and my adherence to certain diet and those sorts of things. And it's helpful.
Yeah.
But I'm not sure in terms of physical therapy.
Yeah.
But
So I'd say with my medical software, the home exercises are built into it. So a patient has a portal, and so they have, access to their initial paperwork that they have to fill out. That's all electronic signature.
Yeah.
They have their, essentially where I document each session, and then their home exercises are in that. So I can upload videos through my software.
That's
and
helpful.
essentially say, frequency, how often I want them to do it daily, every other day, repetitions, sets, and they can check off in their patient portal if they do them or not, and which ones they do on a daily basis or every other day basis. So that's a way, and I can go in and see if they've checked it off or not. Now, do patients go in and check them off all the time? No, but there's some patients that do, and there's some patients that like a regimented list of things.
Yeah.
And so they're like, this is really helpful, and you can see if I'm doing them or not. And then I have my other patients that are like, no, I've done my exercises, but I'm not checking that off in the patient portal. They're like, they're great videos to have
honor
as
system.
reference.
Yes, exactly.
Well, that was another question, actually, because I know Dr. Brown talks about the client-practitioner relationship being so important. Like, you have to kind of want or be open to somebody willing to help you, right?
Yes.
If that's not there from the very beginning, it's not going to kick off. The relationship's not going to develop. And I don't know if that's something you experience, but I mean, how do you address somebody who might be resistant to some of the techniques or methods that you're implementing? And do you have to say sometimes like, we can't really work together because of this, or what methods are you using to get them on board?
I think I always start off with, hey, if they're unsure or I'm getting that feeling from them of, ooh, I don't really know about this. I always say, why don't we try this technique? And if you hate it, we never have to do it again.
Sure.
And really starting off so for example, in an initial evaluation with patient, if they're open to doing dry needling, I will do 1 or 2 needles. I will not do more than that. And I'll say, why don't we see how your body responds? And some patients are like, ooh, I don't know. I really don't like needles. And I'll try and take the time to explain to them, hey, this is what it's doing. This is the process. This is essentially the results that you could be able to get with it, and really explain the benefits. And
you might not want to call it dry needling. You know, it might if you come up with a different like
trigger point therapy.
Yes, exactly.
Muscle,
as soon as you say needle,
decrease muscle tension.
or just say it's like some new technology or something like. I mean, it is working with people and how they relate, because
How do
you
you
say
address
needle.
Right.
Oof,
Right.
you know.
And so I usually explain, I'm like, it's a teeny tiny needle. And
Don't even show it to them, because you put it in the little plastic sleeve when you do it. Some do it when they do the dry needle, or you do it straight.
I do it straight. Yeah. So it's in a tube, and then.
Yeah, it's in a tube,
Yes,
though.
it's in the tube. Yeah.
So-
I typically don't show them, or I say keep your eyes closed. But so if there's a technique that, like if you really don't
I had
like
that
needles,
done
you
in
can close your
Korea.
eyes.
Actually, on my trapezius, I had them dry needle and do like some other imaging, and it wasn't bad. It was surprising. I had never had it done before, but
you only had it done once.
Yeah. It
That's
was
one of the
once.
things. You need it
So-
usually more than one session.
Yeah.
Yeah.
And that's the thing. If you're going to open yourself up to trying it, then you need to be.
Committed.
It's like everything else.
Yeah.
Right. It's not going to fix it
You might
just
wanna
with
try it
one
again.
session.
You're welcome to come on in.
I know someone
can
now.
help you.
Yeah, that'd be great. That honestly would be great.
Yeah.
So
I'll hold the camera.
here we go. Take this.
Perfect.
Yeah.
We'll set a date. But but I think in regards to just different techniques, always explaining what it's doing, why it'll benefit them, and how much faster it can kind of progress them in where they want to go to reach their goals. So we always talk about goals, where they want to get to, and so really formulating a plan that they feel comfortable with. And if there's hesitancy or questions with that, I'll try and answer any of their questions the best of my ability. I'll always, in formulating a treatment plan for them, I'll always make sure that they're on board and they feel comfortable and okay with it. And if they don't, I always try and adapt and modify. And if there's a treatment that they essentially are questioning more or don't like, then again, always modifying and adapting to make sure that everyone's on the same page, the patient's happy, I'm getting the progress that I want, they're getting the progress that they want, and going from there. And there's definitely been times where I've had to have a conversation with a patient saying, hey, you know, if this is essentially not your idea of kind of the road that you want to go down or the commitment that you want to make with our kind of sessions, this is my experience and how I can get patients better fastest.
Right.
But it's teamwork, and it's going to take both of us. Or if a lot of patients are non-compliant with their home exercises, and I'm like, you coming in to see me once or twice a week will help, but it's not going to
like
get
plateauing.
you where you exactly. So I'm like, it's really teamwork, and so educating the patient on that and really making sure that they're up for that. And sometimes it's a difficult conversation where I'm like, if you're not doing your exercises, or, you know, doing things that we discuss that you can help better yourself outside of the clinic, then that's going to be tough and really pushing you to where you need or
And the reality
want
is
to be.
you have other clients who need it.
Yeah.
And so sometimes you let go.
Yeah,
Right?
but
some relationships are relationships.
Yeah.
You
But
know?
I will say most of the time with kind of the patient population that I'm seeing, they're very motivated. So that's the kind of beneficial thing when a patient's referred to me or sent to me. They're already they already have an idea of what they're getting into, but making sure that, they understand that and feel good about it.
Yeah. That's one of the things is really trying. The reality of it is that we're not able to do everything for everyone.
Right.
So it is, unfortunately, that's just the nature of it. And, I will take cases and I'll do it as charity. It's like that I've already accepted that. And that's in large part, also starting the nonprofit is for the same reason, to be able to get other clinicians to come into it as well.
Right.
But even then, for those who have done charity, sometimes those relationships are not healthy. So you have to kind of, it's fascinating.
Case by case.
Yeah.
I've learned so much as a physician, interacting with patients.
Oh yeah.
That it's been invaluable, and it's also, I've been humbled and very fortunate because of the experiences I've been brought into. Imagine being brought into somebody's home and experiencing how they live. Is a very insightful and profound.
Right. And very unique experience.
I've been in a lot of people's homes. Now that I think about it, it's like, wow, this is interesting. A lot of strangers.
Yeah, right.
One of the things is also, as we talk about the education part of it, is anything that we might come across, the dry needling,
right.
Maybe we can break that down into some bites and maybe not call it needling and put it into something so that maybe that can be also part of the legacy of passing things on. And maybe because there are a ton of products that people are pushing. You see on TikTok, there's always something new.
Yes.
There's this one I saw recently. It's this thing. It's a pump, and they put a pillow here.
Yes, and it cracks your neck.
I don't know about that. Yeah.
When I first saw that, I was like, I want to try that.
Yes, right.
And then you read the comments, and they're like, it doesn't work.
I'm not sure about that.
I'm now quadriplegic. Yes, thank you.
You want to find a PT after you use this.
It's a marketing strategy.
I think it'd be actually kind of funny, and we could maybe even acquire some of these products. And I actually have one.
We've done a couple.
Yeah, we've done.
Yeah.
So I ended up getting the compression sleeves. So this is the Normatec.
The Normatec. Yep.
Yeah, the Hyper Ice stuff.
Yep.
And I just sit there like a little donut.
Yep, for 45 minutes.
I'm like, oh, this is good. It's probably mostly mental, but no, I mean, I do feel, especially when I start engaging in physical activity, like with Carlos.
Yeah.
Getting older, a lot of things stay sore for a lot longer.
Can help with muscle recovery. I have a lot of patients that ask me about the Normatec sleeves, and I'm like, if you feel like it helps, but gets blood flow to the area, and so any sort of muscle mobility post workout.
There's peculiarities about it. Like if there have been times when I've, and these are the things that we can go through, because I've used that in particular to try to avoid, because I'm moving around. So if I'm walking around because I'm so sore, that doesn't look good.
Right.
So there was a desperation to use the Normatec to try to get it. And the thing I find out is that if I don't use it an hour after doing, intense workout, it's gone. I mean, if I tried to do it like the next day, too late.
Yeah.
There's a physiology and all of this behind it, which is just fascinating.
Right.
And there's always these other products
that
people are doing. I have one this ring.
The Aura ring.
A lot of my patients are wearing that. I haven't.
I have horrible sleep.
Tried it.
Every day. It's like I keep looking at the app. I can't do anything about it. But no, there's these fascinating things, which I think would be kind of fun to talk about.
Oh, 100%.
So if there's things that you see, you're like, oh yeah, write it down, and then maybe we can come back to it, and maybe we can design it into sessions with Danielle.
Yeah, I think that'd be fun.
Yeah.
The best thing is to see it in action. Like we've done some different unboxings and things like that, but the Hyper Ice or the Normatec leg sleeves, I mean, we got to film that whole session while Dr. Brown's like sitting there
just
on the living room floor. Yeah, but it was actually, I think, for people viewing, very, very informative for them, because they got to see how you would sort of carry on with, maybe you were doing some emailing while you were letting that set in.
Exactly. The, 45 minutes that you're sitting there.
Right.
Yeah.
So thinking about, how could you implement this into your routine? It can't be something that takes you totally out of your routine. It has to be something you can sort of like run side by side while you're doing other things. And if it's not one of those things, maybe it's probably, it may not fit into your lifestyle very well. So,
Yeah.
And you work with athletes, so part of it is also they are, in a sense, experts.
Yes.
And so even if you have clients who have some things, little tricks or things that they do, be fascinated. You know, there are certain things, even like, you know, I'm not a runner. I'm a biker, so I'll bike. You know, that's great. Physiologically, running, not a thing for me. That is just never going to happen.
Yeah.
But I would do Orange Theory, you know, and I'd realize I don't know how to run.
Yeah.
And it's just fascinating that's why I'm not a runner, is I don't even know how to run. It was weird.
yeah, the technique's not there. If you run poorly, it will like mess you up.
Yes.
Yeah, that's-
Seriously.
Yes, injury.
That's
It
why-
will definitely lead to injuries for
Yes. Like the whole. I mean, I didn't. You know, I'm older, so it was just like, yeah, you just run. No, definitely.
So
not.
Actually.
one thing though, a lot of my patients will come in, whether they're, you know, teenager, a lot of rowers recently, actually, like high school rowers, I'm seeing a lot of recently. But so teenagers to anyone from their, you know, 60s, 70s, a lot of weekend warriors. But majority of people aren't familiar with the proper warm-up technique, with the proper post-workout run, bike, whatever activity they're doing, post-workout recovery to help with injury prevention and help with muscle recovery.
Yeah.
And then the things that they should be doing while they're working out. So most of the time, people don't know how to activate their core properly, how to activate their glutes properly, posture. You know, most people are like here with the forward head, rounded shoulders. Most people are like, oh yeah, I'm sitting for 8 hours a day. And I'm like, how many times do you get up?
Yeah.
I don't know, maybe once every 3 hours. And I'm
Yeah,
like, trigger
3.
points start to develop in muscles every 30 to 45 minutes that you're stagnant. So really educating people on what they can be doing to limit the amount of injury that they have and for injury prevention. And I've actually given a few webinars and talks to like triathlete clubs, and I work closely with a running coach, and we've put together some presentations on that because it's a huge thing that most people don't do.
The only way I got it through the Six Skull was actually Pilates. Pilates was the only way I could get myself to get it.
Yeah, and that's great. I think,
I used to do it every day, and I haven't done it in a while just because I moved. But I'm hoping Vita has actually Pilates.
Yeah, they do.
Yeah.
It's wonderful. I highly recommend.
Do you go?
So I have a lot of people who I work with at Vita. I know a lot of the instructors, and they're wonderful.
I really need to motivate myself because I have a membership, but I just haven't gotten around to it. So the one on Navy Yard is the one I usually go to.
Okay.
And they have a good Pilates studio, and I've gone in there and like when nobody's looking and like done all the equipment myself.
Yeah.
But doing it with a class or would be good
with
again.
an instructor. Yeah. And I think that is a great thing. Pilates Bar are great kind of exercise routines and workouts that you can really hone in and strengthen the little stabilizers and the deep core that
the ones that
no
really
one
hurt,
thinks about.
but
the ones
really
that really hurt that no one thinks
they
about.
hurt so much.
My
God.
And matter a lot. I know I don't do nearly enough. I'm like, go resistance train and then come back here and drink a protein shake and go to sleep. I know that's a horrible sort of way to go about it, but
I mean, it's not horrible, but it's just kind of like if you wrap you're there almost. You're like just a little bit more.
Yeah, and then
you could really tone in and get it. But it's one of those things.
Yeah, it's getting into the habit of it.
Exactly,
Right.
which I think is the hardest thing for people.
Yeah.
And it's hard to carve out that time. And even if it's just 5 to 10 minutes a day, really making it a daily routine habit. Once I think it becomes that routine or habit, it becomes a lot easier for people to wrap their heads around it. But it's a really hard thing for people to grasp and to want to be motivated to do. But then the magical thing is once they're like, oh my gosh, Danielle, I'm actually doing what you're telling me to do. You know what you're talking about. They're like, I feel so much better.
Told you.
And you're like, aha, the light bulb. Oh, no.
It's funny, these little hacks, because I just started recently doing something that, I'm a guy. So, but in the morning, I was just reading something and it was like, yeah, when you wake up in the morning, immediately do 8 to 12 ounces of fluids.
Yeah.
I never did that. I'd go and get coffee.
Yeah.
But now, as soon as I get up on the side of the bed, and I feel it. I've only been doing this now for a month. I'm like, I should have been doing this for decades.
You're like, I feel so much better.
Yeah.
It's like you think about, you're sleeping, you're not drinking water, and so you've gone this long for not hydrating yourself.
Long
and then
period of time.
Typically what someone will put in their body, I was actually having a conversation with one of actually the personal trainers that I'm very, very close with, and he's like, people put in caffeine like as soon as they wake up, but they've been dehydrated for 8 to 12 hours.
Yeah.
So why are people putting caffeine in? So he's like, hydrate and then caffeine, or hydrate bone broth then caffeine.
So now there are certain things. I do have an app now that reminds me to drink my water. I don't have to do it anymore. And there are certain things I do in the morning that's it's ingrained.
Yeah.
Unless something really throws me off. I'm tuned in, and I know when I'm not, then I really suffer for it.
The Aura Ring will tell him.
Yeah. Man, I might have to get one of these.
This one is actually supposed to be coming out with being able to check your oxygen level too.
Really?
Yes.
Wow.
So that's why I got it, because I want to evaluate this for clients. Mm-hmm. Not that it's going to check for sleep apnea, but certainly during peak activity and those sorts of things, you want to see what your oxygen's doing.
Yeah.
So it hasn't been released, and it's kind of a gripe of mine, but it's supposed to be this year.
Oh, interesting.
So I would hold off until they've actually rolled it out.
Yeah.
So don't.
I think they said it would affect battery life negatively, very slightly, but
Slightly,
I did a review on it, and it's out, I think, and I'll share that with you once we're wrapped, so you can kind of get a sense of the process, because it is a process. You have to test the ring size to make sure they send you the right format and all that. So there are a couple steps to it, but I think you've enjoyed it from what you've said. So.
Oh yeah. I mean, it's insightful. But so you also work with functional and integrative medicine physicians.
Yes,
too.
I do.
There particular practices in DC, like NAMI or?
So unfortunately, not in DC. The practice that I work closely with, he is the solo practitioner. His name is Dr. Robert Duca. He actually was in the chiropractor world, and then I think was having a lot of patients with some weird autoimmune systemic issues, and then he transitioned to naturopathic medicine and is a functional medicine doctor. And through my own personal story and a slew of weird health autoimmune issues, I got to know him, and I've been working with him over the past decade. It's probably been like 12 or 13 years now that we've been working together.
That's awesome.
And so through my own personal experience from getting passed from specialist to specialist to specialist, and no one being able to figure out what was going on, and then eventually I was recommended to go to him, and he really figured everything out, and really, again, takes the time, looks at all the pieces of the puzzle. And so I've sent numerous patients to him over the years, and vice versa.
So that might be also an interesting tie-in. So if you want to reach out to him too, because that was your journey.
Yes.
Right. So, I mean, part of it is even for myself, I'm not bashful, for the things that I have gone through myself.
Right.
It's being humble about these things.
Right.
But then it provides an opportunity to be able to expand it out and then bring in more. So it might be something to explore. Because I do work with other functional physicians, MDs, that do integrative functional medicine, and naturopaths. Yeah. In the district, unfortunately, naturopaths have a lot of difficulties. There's a lot of, it's a very different environment. Certainly if you go out California.
Yeah, Washington State.
Washington State.
Yeah, the way that we met Dr. Ben Magoon, he was a naturopath.
Yep.
And had good success out there doing that. So,
but here it's problematic as clinicians and naturopaths that I've known and respected. It's challenging for sure. But it would be fascinating.
Yeah, absolutely. He's on Dunloring, so right by Tyson's Corner. So not too far far away.
Yeah. That's easy.
Easy enough to get to. Yeah, well, I wanted to, I guess, sort of wrap up by asking you what's next. I mean, you've obviously expanded into a second location, which is phenomenal. Plans for doubling that? Or, I mean, you have to maintain a certain quality of care, and I think when you grow too much, maybe you separate yourself from that a little bit. So how do you strategize for where you go in the next 5 years or so?
So great question. So the clinic that I have at my Gallery Place location is one office. So one person can be there treating so one PT can be there treating at a time. At my U Street location, I have in my office, I have 3 different treatment rooms.
Okay.
So the short-term goal is I can essentially bring on 2 more physical therapists eventually. I don't want to rush that. I want to take my time.
Yes,
It's hard to find a good PT.
Oh my God. And physicians, forget about it. I gave up. You know.
When I hired my physical therapist, it took me 4 to 5 months to find her, and I would start off with a phone interview and then bring them in and have them work on me as an interview. So I would pretend to be the patient and go through patient cases and say, hey, do this manual technique here, dry needle here. So to really see how their manual skills were.
Yeah, that's great. That's smart.
They're,
because it's your
4 to
clients.
5 months to find. It's hard. It's hard to find a really good practitioner that cares and that has the personality that you feel like will have that compassion and that genuine understanding and that communication with patients, and then to have the manual skills on top of that. So really, I'm not in any rush to grow big quickly, but if I find the right people, then that is my goal. And I think her schedule's starting to fill and build. So if that stays consistent, then I think maybe fall, I'll start putting out feelers to find another physical therapist, but we'll play it by ear.
Yes, sure. Good. Yes, definitely. Yeah. Well, Danielle, thank you so much for coming in. And it has been an honor to know you and a pleasure to be able to work with you. And I certainly think there's lots of opportunities for us to kind of go on a journey with clients. And we hope with viewers as well to be able to share those. Any viewers out there who have questions, particularly in terms of physical therapy or any concerns about the care they are receiving for physical therapy, we'd love to hear from you. Any other stories or questions from viewers too for Danielle or about the series itself, we certainly welcome that. And so we'll just stay tuned and we'll be back before you know it.
Yeah. Thanks so much for coming in.
Thank you so much for having me. And likewise, it's been an honor and a pleasure. So thank you.
Excellent.
And if you happen to find any of this interesting, or more importantly, if you want to collaborate, check out the link below so that you can send us your comments, any stories you may have, anything, we're happy to entertain it. And this is really about us going on a journey together.